Well, we're going to go ahead and get started. Welcome to our third Thursday webinar this month. Excuse me. My name is Amy Lukes, and I am director of the AOT implementation team here at Treatment Advocacy Center. Sorry about that. Today we are well, first, let me introduce the other members of the implementation team. Betsy Johnson, who is our AOT policy advisor, and Brooke Gentry, who is our AOT implementation coordinator, who keeps us all on track and keeps the trains running on time. So we are very excited to have our own research department present. They did some exciting work in Ohio, mainly last year. It was a process. I think data collection was about 6 months, but anyway, the satisfaction survey was given in Ohio. So Betsy wants to be sure that I do a shout out to Ohio and express our appreciation to all those of you who helped us with this project. So we have Elizabeth Sinclair Hancq, who is our director of research, and Shanti Silver, who is a research assistant, joined us in September once we had the data collected, and did a great job of analyzing the data. So I'm going to hand it off to them. I forgot I'm just going to hand it off. Sorry. Who's going first? Elizabeth?
I am going first.
All right.
I'm going to pull up our slides here. So thank you all for coming and joining us today. Good afternoon. While Shanti's pulling up the slides, hopefully everyone should be able to see that. Again, yeah, so as Amy mentioned, my name is Elizabeth. I'm the director of research here at the Treatment Advocacy Center. I'm going to be doing just the first few slides of this presentation, and then we'll be handing it over to Shanti, who really did the bulk of the analysis and writing of our report that we just released in January. Which were the results of our research measuring AOT participant satisfaction. And please make sure you stay tuned till the end of the session, because we're going to be sharing some exciting resources for you all. But first, let's just talk briefly about the benefits of collecting data. There we go.
Give me a second.
Thank you, Shanti. So collecting data on the impact of AOT on participants can have a variety of benefits that includes increasing an understanding and awareness of AOT, and helps us really understand what is going well in different areas for improvements. It also can help inform us how participants feel about the AOT program, which we feel is very valuable, and it's where this project came from. And importantly, can help to obtain and sustain funding for AOT programs. There has been a variety of different evaluations published on the impact of AOT already. Briefly, and many of you are already familiar with these, previous evaluations have found that AOT participants, after being enrolled in AOT, have fewer hospitalizations, fewer barriers to accessing treatment, fewer criminal justice involvement, such as fewer arrests and jail stays, less victimization, and will lead to more treatment and higher medication adherence. Really, I do want to emphasize here that in order to have some of these conclusions, these evaluations have to look at outcomes over time. So it can be a little bit more burdensome than perhaps looking at just how participants feel about this, their involvement in the study, which again, this can be a little bit easier to do, as we'll share more later on in the talk. And the most comprehensive evaluations to date have mainly been conducted in New York on Kendra's law, in part because data collection is mandated as part of the state statute there. So all of the programs have to collect data on participant outcomes. But only a few of these evaluations have asked participants how they feel about the AOT program. So as you see here on the screen are some of those results of again, both mainly from New York and Kendra's law, where a 2005 study found that about 81% participants agree that AOT programs help them get and stay well. 3/4 of AOT participants felt that AOT helps them gain control over their lives, and just short of 2/3 agreed that being court-ordered into treatment was a good thing for them. In 2009, an updated evaluation of Kendra's law, the researchers found similar levels of satisfaction between AOT as well as voluntary services, which of course is something that is perhaps a misconception about AOT, that people do not like it and therefore would prefer voluntary services, so that this evaluation helped share some of those results. And then in the 2018 SAMHSA evaluation, which is an evaluation of the 2016 round of grants to AOT programs throughout the country, they found that 92% agree with the statement, "I like the services I receive here." So recognizing the importance and value of measuring participants' thoughts, feelings, and beliefs, we at Treatment Advocacy Center decided to embark on this project to make it easier to take the perspectives and opinions of participants into account when determining the impact of AOT. So first, we developed a AOT participant satisfaction survey, very specific to AOT, because there really wasn't anything else like this out there. We looked at the previous use surveys in Kendra's law and the SAMHSA report, as well as other satisfaction surveys using mental health services research, and developed our own survey tool. We got feedback from a variety of different experts, some of those that conducted the Kendra's law study, and then tested the survey tool through evaluating participant satisfaction in 6 Ohio counties. So I really do want to thank those that participated in Ohio and helping us work through this. It was, as Amy sort of mentioned, it was a process. We conducted, it was 2021 actually, where we did most of the data collection during the Omicron wave of the COVID pandemic, and so it was a tough process, but we were able to get it done. And we worked with each county individually to develop a data collection plan and work through logistics about how the survey would be handed out, and the data, the information got back from the participant, the incentives. We gave gift cards to participants to incentivize participation and to thank people for their time and participating in that sort of thing. And again, we published the results in January and have some, which the title is Measuring Experiences, which is the title of this slideshow. And please do stay tuned to the end of the talk so we can share some of our resources. And with that, I'm going to hand it over to Shanti to go through our results.
Sounds good. All right, so I'm really excited to share with you all what we found about how satisfied AOT participants were in these 6 counties that we collected data from in Ohio. We want to kind of start by talking about the general levels of satisfaction, which is what you see up here. So I wanted to say a little bit too about how we measured satisfaction. So for this survey, what we did was we showed AOT participants a lot of different statements. So things like, for example, in the AOT program, I feel my legal rights are protected. And we asked them to rate how much they agreed with it, from strongly disagree to strongly agree on a 1 to 5. So the percentages that we're showing up here are the percentage of people who somewhat agreed or strongly agreed with the statements that we asked them. And then for some of these as well, like the first kind of column here that says satisfaction with the treatment team scale. If anything, you see scale in one of the things that we're talking about. what we did was we asked a couple different questions, trying to get at different aspects of, for example, satisfaction with the treatment team. So we would ask participants to rate their agreement with statements like, the treatment team believes I can grow, change, and recover, and statements like, I have enough opportunity to tell the treatment team what I think they need to know. By doing this, we were hoping to kind of capture a more holistic picture of satisfaction with the treatment team. So if you see scale, it just means that we're averaging their agreement across a couple different things that we asked them. So overall highlights. So the first thing that we were really happy to see is that for the most part, AOT participants are really satisfied with a lot of different aspects of the AOT program in the counties that we look at. And these high levels of satisfaction are pretty comparable to what we've seen in some of the other studies that Elizabeth mentioned in the introduction. So in particular, in our study, we saw really high satisfaction with the people that AOT participants are interacting with in the program. So satisfaction with the treatment team, satisfaction with the court, both of those were over 75% of participants agreeing that they were satisfied, which is really fantastic to see. We also saw pretty high agreement for things having to do with the impact that people feel AOT is having on them. So things like the benefits people perceive from the court order and the AOT program, as well as agreement with statements like, the court order makes me more likely to keep appointments and take medications, and all of those being pretty high. Around closer to 50% of participants agreed with things that had to do with kind of general feelings towards the AOT program. Things like, I like the AOT program. About half of participants would agree. And then a lot were also a little bit more neutral on that. So we did give a neutral option. We're asking people to rate agreement. We also saw agreement hovering around 50% for things that have to do with kind of procedural justice or the perceived fairness of the AOT program, like we saw with legal rights. And then over here on the next slide, these are all of the things that we asked about where agreement was, or 50% or fewer of participants agreed. And a lot of these hovering around 50% have to do with that fairness, like the court order has been for the right amount of time, or having control over treatment, or feelings towards the program, like the court order makes me angry. And by far the lowest agreement out of everything that we asked was agreement with the statement, the court order should be done again in the future if needed, which we found pretty interesting because it kind of signals that looking at everything together, that overall AOT participants were quite satisfied with the people who they work with in the program. They feel like they're benefiting from the program is impacting them in positive ways. But they're not necessarily willing to agree that this should be done again, even if they need it. And we kind of signal this to probably be speak a little bit to the effect of having a court order that has someone going into treatment where participants can agree that they benefit from the program, but also leave space for kind of the fact that this can be an experience for people that's difficult, which might be leading to this lower number that we see in willingness to endorse that the court order should be done again. But definitely overall, we were very happy to see these high levels of satisfaction on most of the things we asked about across the board. And after we had looked at overall satisfaction, the next thing that we wanted to look at was seeing if different groups of people, different types of people had different levels of satisfaction with the AOT program. And one of those groups that we wanted to compare were racial and ethnic groups. So in the data that we collected, just because of sample size, we were only able to compare Black participants, white participants, but would definitely be really interested to see how things would be different for different reasons to suspect that Black participants and white participants might have different levels of satisfaction with the AOT program due to previous experiences in psychiatric care. Just overall in America and some other Western countries, Black participants or Black patients in general are more likely to experience coercion in the psychiatric care process. And that also applies to AOT, in that in New York, one of these studies of Kendra's Law compared the proportion of Black participants in AOT with the proportion of Black patients in the public mental health system overall. and found that Black patients were overrepresented in AOT, which kind of speaks to that being a little bit more likely to experience coercion. Black Americans with untreated serious mental illness are also more likely, have been shown to be more likely to have criminal justice interactions than white Americans with serious mental illness, which could certainly impact feelings towards the courts in the AOT process. And additionally, before entering AOT, just speaking very generally, Black Americans are somewhat less likely to have had access to mental health services than some other racial ethnic groups. So we were not sure going into this how these factors would combine to impact satisfaction, if they would at all, but we decided to take a look. And interestingly, what we found was that across the board, Black participants were more satisfied with the AOT program than white participants were. True for almost everything we asked about. These are just a few of the things that had statistically significant differences. And the reason, and so these mostly have to do with the impact of the court order. So being more likely to take medications, keep appointments, and also general satisfaction with the treatment team and the courts, as well as another measure of benefits of the court order. And these findings we interpreted, or at least the reason we think we're seeing this is likely due to decreased or diminished access to services before coming into the AOT program from Black participants that may have made them more satisfied with the same level of care. But of course, we would be really interested to see, as hopefully this survey is used in other places outside of Ohio and other regions of the country, how and if these results change would definitely be something that we think is worth looking into. When we were comparing group differences, we also did compare by satisfaction by gender, by age, but there really weren't any major differences in satisfaction between groups that we could find other than the satisfaction of Black and white participants. So that was something that we certainly found to be very interesting. And in addition to looking at demographic differences in satisfaction, which can be helpful in informing to pay attention to in the program for different types of participants. We also wanted to compare the satisfaction of people who plan to continue an outpatient treatment following their court order and people who don't. The reason that we wanted to do this is that one goal of the AOT process is to help participants understand the benefits of being in treatment and hopefully encourage them to remain in outpatient treatment should they need it following the end of the court order. And so in our sample, we did ask about plans to continue treatment following the end of the AOT program, and about 2/3 of participants said they plan to continue. About 1/3 said that they did not plan to continue in treatment after the end of their court order. And within our group, the most common reasons for planning not to continue treatment were feeling like treatment wasn't necessary, saying, I don't think I need treatment, or wanting to solve the problem without external treatment, wanting to solve the problem on one's own. And so we wanted to compare areas of satisfaction that might be different between people who plan and don't plan to continue in treatment, kind of hoping that this could point us in the direction of some factors that could just be useful for us to pay attention to as we try to encourage more people to stay in outpatient treatment following the end of AOT. So when we looked at if there were areas of satisfaction that were different between people who plan and don't plan to continue outpatient treatment, the answer was yes, and there were a lot of them. These are just some of the statistically significant differences that we found. And before I highlight some of these findings, I did just want to touch on what we can and can't conclude based on this analysis. So for example, with when we look at satisfaction with the treatment team, we see that people who plan to continue treatment following the end of AOT are statistically more satisfied with the treatment team. However, we wouldn't want to see that and necessarily conclude that people who have a worse experience with the treatment team are less likely to continue treatment. It could be the case that people do have a poor experience with their treatment team, and that makes them less willing to continue in outpatient treatment. It could also be the case that people who never wanted to be in treatment rate the treatment team more negatively, and that makes their scores lower. So it's just and we really can't say what it is for sure. It's more just, this is something that can be useful for us to kind of have areas to think about and to pay attention to as we work towards the goal of helping people or encouraging people to stay in treatment if that's something that would be beneficial for them. So within all of these statistically significant differences that we found, the main ones that we wanted to highlight that we thought were most useful when thinking about this goal of encouraging people to stay in treatment were the difference in agreement in the statements in the AOT program. I feel my legal rights are protected, the court order has been for the right amount of time, and the court order makes me more likely to take my medications. These differences in feelings that legal rights are being protected, that the court order are being for the right amount of time. These both have to do with kind of feelings of being treated fairly in the AOT process. And those are hopefully things that, through dialogues, through raising awareness, this might be a difference that we're able to decrease. It also might not, since we're not able to say for sure what's driving these differences, but definitely areas that we thought were interesting to pay attention to. And then the court order makes me more likely to take my medications, indicating that perhaps people who don't plan to continue treatment have perceived less of an impact of the treatment that they've received in AOT. It's just another area to kind of pay attention to as we think about, who's planning to continue in outpatient treatment, who's not, and the reasons for that. So another thing we wanted to look at outside of comparing these group differences were predictors of satisfaction. When we say predictors of satisfaction, what we were kind of wanting to find here, it was basically the question of what areas of the AOT program, the AOT process, are most closely related to liking the program overall. And similarly to what we just looked at with people who do and don't plan to continue treatment, we can't draw any conclusions about why these things are related just because we find a relationship, but they can give us areas that might be useful for us to look at as we work towards helping more participants to like the program, which is one of the goals. So what we found when we looked at relationships, well, these are just 4 of the relationships that were strongest and that we found were most interesting. But we found that people who agreed more strongly that their court order had been for the right amount of time, that their legal rights were protected, that they were satisfied by the courts, and that their court order makes them more likely to keep appointments, were also likely to agree more strongly with the statement, I like the AOT program. And the reverse is also true. So people who agree more strongly that they like the AOT program also agree more strongly that they're satisfied with the courts, for example. And these numbers on the screen, in this case, these are called correlation coefficients. The important things to know about them are bigger numbers kind of indicate a stronger relationship. The strongest would be 1. And so these are kind of moderately strong. They're definitely not super strong, but they're not small either. So they're are big enough that we think they're worth noting, certainly. And some of the things that we wanted to highlight from this is we see these measures of fairness showing up again as things that are closely related or moderately closely related to liking the AOT program. That feeling like the court order had been for the right amount of time and that legal rights are being protected. So that's certainly something of note. And then we also see being satisfied with the courts and feeling like the AOT court order is having an impact, is making people more likely to keep their appointments. These are also things that we found were moderately closely related to liking the AOT program and all areas that we thought would be useful and interesting, certainly interesting to us to highlight as we think about hopefully having more people agree with this statement that I like the AOT program while they're in it. So in addition to asking participants to rate their agreement with statements, which is how we looked at satisfaction for a lot of this survey, we also wanted to give participants the opportunity to tell us in their own words what they liked and didn't like about the AOT process. So as a kind of a contrast to what we've been looking at so far, which are statements that we wrote, we consulted with experts to measure satisfaction. In this open response section, we asked a question and told participants in as many or as few words as you want, tell us how you feel about this. And so some of the results from that were certainly interesting, and that is what we will go over now. So the first question that we asked participants was, what do you like the most about the AOT process? Participants would write out a response, and then Elizabeth and I went into these responses and coded them into themes based on things that we saw appearing most commonly in participant responses. And the biggest one that we found, the biggest theme in response to this question, was 51%, a little over half of the people who answered this question said that what they liked most was the people. So for some people, this was their treatment team. For others, it was getting to see other people, other people who are in the AOT program. For others, it was the judge or the magistrate or the courts, depending on the terminology that the program uses. And so just like as some examples of the things that people wrote, one person wrote that what they liked the most was the friendliness of staff and judge, that they feel free to express their feelings and concerns with confidence that AOT will help solve the issues. Another person wrote, it helped me get out of a bad place. I like the feeling that someone wants to see me succeed. And another reasonably large, about 20% of participants who responded to this question, this was the other major theme that we identified, had to do with feelings of health and safety. People who wrote things like, keeps me safe, I like that it helped me get healthy outside of a medical environment, or keeps me out of the hospital in response to this question. And those were our two biggest themes, were the people and health and safety. And we also asked participants, what do you like the least about the AOT process? And the biggest theme that we found here was coerciveness. So people often wrote things about the fact that they have to attend things, that there are a lot of meetings that are mandatory, medication orders, the amount of time it's taken from my life is something that someone wrote in response to this. And then the other major theme that we identified was inconvenience. So for example, someone wrote early mornings in response to this question. I think somebody else also wrote it should start earlier. So feelings of inconvenience, of mostly appointment timings and things of that nature being what they like the least about the AOT process. And finally, we asked participants in this open response, how has your life changed as a result of participating in AOT, if it has changed at all? And in response to this question, we saw 64% of participants did report a positive change. People writing things like, I am now working at a job, my mental health is much more under control, and even I think my family trusts me more versus if I didn't attend. About 10% of participants who responded to this question expressed that there had been a negative change in their life. So for example, one participant who wrote, I'm more exhausted due to all the appointments, would be an example of a negative change. And about 10% said that this hasn't really impacted my life. But we were definitely very happy to see that 64% of participants reported a positive change in their life as a result of participating in AOT. And that kind of feeds into our key takeaways of this little pilot study. The first one, and this is in line with other studies that have been done in the past on AOT and looked at satisfaction, is that most AOT participants are satisfied with the AOT program, or at least many aspects of the AOT program. And we saw that in the quantitative rate your satisfaction questions that we asked people, where satisfaction was upwards of 65% for most of the things that we asked about, particularly things that had to do with the people in the program, the people who they interact with in the program, the treatment team and the courts, and the impact of the program. And we saw that again in the open response as well, with over 60% of participants saying that the programs had a positive impact on them. One of the other things we got from the open response and from the rate your agreement style questions was the importance of relationships in AOT. So we saw when we asked people, what do you like the most about the AOT process? The number one response was not it keeps me healthy. It was, I like the people who I interact with. I like the people who help me. I like that there are people looking out for me. That was the most common response when we asked people in their own words what they liked the most about the AOT process. And we did, of course, see that echoed again with 80% and 75% of participants agreeing to some extent that they were satisfied with their treatment team and the courts. Another one of our big takeaways was that AOT is, of course, a coercive form of treatment. And the relationship between coercion and satisfaction is kind of complicated. It's not been studied very much. There have been a few studies within healthcare that have looked at this, but at least in our study, we saw in the open response that this was the number one thing that came to mind when people were asked what they dislike about the AOT process. But we saw in some of our rate your agreement style questions where we asked about perceived benefits of the court order, perceived benefits of the AOT process, that although participants dislike coercion, they do perceive benefits as a result of that coercion to be in treatment. And I think that's a fine thing for us to be aware of and give space to, that this can be difficult for people, the experience of being court-ordered into treatment, but it can be difficult and people can also recognize the benefits of being in there. It's just kind of something for us to be aware of as people who are in the world of AOT, and also definitely something that we think warrants more exploration within AOT. And our final takeaway of doing this pilot study was that measuring satisfaction within AOT with AOT is very feasible. That this survey appears to work well. It takes about 10 minutes to go through, and there's a whole wealth of results that we can look at, such as the ones that we've presented today as a result of the survey, which can, we hope, provide a lot of value to programs who are wondering how participants are feeling about the AOT program and who want to collect data in a more systemic way that can also be shown, of course, to others to raise awareness about the benefits of AOT, as well as, it's just kind of serve program improvement purposes as well. If there are some areas where satisfaction is low, there's a lot of utility that we would hope would come out of this survey. So with that in mind, this AOT participant satisfaction survey that we used for this project is free, it's available. Brooke will be sending out a link to it as well as some other resources following the end of this presentation. In addition to the survey, which is customizable for the specific language that your county might use. If, for example, you don't call assisted outpatient treatment AOT, it's called something else. There's a Word document that you can edit to make those things, and we've had designated clearly where those edits might want to be made. So that customizable survey is something that's available. We have a sheet of survey best practices if you'd like to administer the survey, some general things to know. And we also have a data collection tool that's a template where after participants take the survey, you'll be able to enter data, and it does have some automatic reporting features as well. So as you enter data, if this is something that you choose to use, you'll be able to have some statistics and some graphics made in real time with that updated data. And yeah, that's the bulk of what we wanted to share with you today. I will stop sharing my screen, and I'll say that we additionally, all right, is my screen still sharing? I cannot tell.
Yes, it is.
Okay, there we go. I found it. We additionally have a caregiver satisfaction survey in the works. If that is something that sounds interesting, we'd definitely be willing to talk about that more. But yeah, Elizabeth, did you have anything else that you wanted to add before we open up for questions?
No, thank you very much. Thank you, Shanti, for such a great presentation. I do see, as you've been talking, I've seen some questions come in. So please feel free, everyone, use the Q&A or the chat to ask some questions. How is the survey administered? I'm going to start with that one. So we worked with each county that participated individually to figure out the best way to administer the survey. We gave the counties options, whether to use paper copy. We actually have an online version through SurveyMonkey, as well as offer to do administer it with an individual participant over the phone. However, for this particular instance, everyone participated through a written survey. So we mailed packets, survey packets to the counties, depending on how many people they thought would be eligible to participate. And I think that was actually another one of your questions, that we asked counties to only give the survey to people that had been in AOT for 6 months or longer. So the program monitors would let us know how many people they thought they might be eligible to take this. So we sent these survey packets with a paper copy of the survey, a pencil, and instructions and information about how the participant can obtain the gift card incentive. And for the vast majority of counties, they utilized their someone within the program itself, but not the treatment team or the court teams to help the participant take the survey. So, sat with the participant and walked them through, how to fill it out. And in some cases, the counties partnered with the local NAMI chapters, where a NAMI representative would then help the participant take the survey, which we very much recommend, because it's, number one, a great way to partner with your local NAMI chapter, but also to help reduce the bias of the results for, there's an independent person totally outside of the AOT team helping the participant take the survey. So hopefully that answers your question. What was the response rate for our survey? And Shanti, please step in if I do not answer this right. Because of the way that we administered it, we don't necessarily know the true response rate, because it really left it up to the county AOT monitors to hand them out, and we weren't necessarily keeping track of in that way to get an actual response rate. But based on what we heard back from the monitors, is that most of the people that they offered it to did end up taking it. I think we had a response rate from one county where we did hear that was it 75%, I think was the.
It was 60% for all counties overall, but some of them were higher than that.
Yeah. Because we had one county that we sent that had a lower response rate than others, I think. But yes. So next question. Let's see. Curious about the demographics. So I pulled this up. I'm going to share my screen, and we can look at our. Can you see that? So this is the demographics. This is from our report. So the demographics of the participants included in the study. You can see the age distribution and race and employment status here. I think this is in perhaps relation to race, I think is when the question was asked. And the demographics were generally representative of the demographics in that particular county of the people in their public mental health system. So did I say that right, Shanti?
Yeah, I think we looked at Ohio as a whole, but we had counties from across Ohio. So
right, yeah. So this is the participants who's filled out the survey, their reported race, ethnicity, 1/4 Black and just under 2/3 white. And then I saw another question about length of time in AOT. So we do have this in about half, where this is their first time in AOT, where there's 40% had been in AOT previously. And then this is the length, figure 6 is the length of time in AOT, whereas you can see actually that there was a significant number of people that said 3 to 5 months, even though we had limited that to more than 6 months. And I think this both perhaps points to the self-reported nature of this, that this is what participants thought they had been under an AOT court order versus their actual time. So let's see, did I answer all of those questions? Was length of time and program associated with satisfaction?
It was not. We did look at it, but we think part of the reason for that is probably, like Elizabeth mentioned, when we gave this survey out to counties, we asked them to give it to people who had been in AOT for 6 months already. That was just based on other research that's been done on AOT that shows some difference in outcomes, things like hospitalizations and arrests before 6 months and after 6 months. But with the results we got back with the self-report, it was unclear how much, if participants accurately reported the amount of time they had been under AOT. So we didn't see any differences in satisfaction across length of time in the program, but it's unclear. That might have just been because we have this an inaccurate self-report on length of time in the program and the data that we got back.
Let's see. Who was offered the survey? Successful graduates only. So no, it was not administered to just people who graduated. It was administered while they were currently enrolled. In some counties, they would administer the survey at the in a more active court model where a lot of the participants were going to court once a week. So they were actually administered before or after they were seen in court. Others were administered when they would go to the AOT monitor's office for some check-in or case management appointment. So no, it was given to everyone that was enrolled, again, for those offered to everyone that was enrolled for 6 months or longer. Total number of responses.
57, I think.
57.
Yeah, not everyone answered every question, but at least 50 for all of them.
And how often should the surveys be completed? Annually or every 6 months? That is a great question. So we did this study with be a point in time estimate, so just to see what currently people felt about their time in AOT. If you wanted to measure satisfaction over time, you could, if this same survey could be given to participants at multiple time points, say after 6 months and maybe after 6 months later, after a year, to see if their satisfaction does change with increased time in the program. And then you could again do it annually as a way to just keep up to date with how satisfaction is going with your program as a whole. Maybe trying not to if someone's been enrolled in the program for more than a year, to not give it to that same person again, because but it really does depend on what you're trying to measure and to help answer. And we can help walk you through that if you are interested in using the survey, we can help walk you through the logistics of how to use it, who to give it to, and some of the different sort of pros and cons about what and how to measure. Is it known how many participants are in each county's AOT program? No, not. we did that. That's how we determined the number of people, the number of surveys to send to each of the counties, but we didn't necessarily track that over time for this project. we do know, generally speaking, how big these programs are. Betsy keeps up to date with these programs in Ohio to know how many participants they have. I think every 6 months she updates that. Is there a minimum number of responses we should aim for before making any overall assessments of our program? Shanti, do you want to take that one?
I guess it kind of depends how many people are in your program. If it's a small program and everybody's willing to participate in the survey, then you can confidently say all of our participants are dissatisfied. Otherwise, it's a little hard to tell, I think. And this is definitely something that we could also help to talk about. In any kind of assessment that you want to share, like, for example, with a reporter or another stakeholder about satisfaction, if you're not sure if it's an accurate representation of your participants for whatever reason, just including a note about what percentage of participants responded. And yeah, I think if we were going to look at like all AOT programs everywhere, that might be a case where we could look for like this percent or this number. But for a program that is relatively, or like one single program, I think whatever you can do, I think can be useful in looking at how participants feel about the program. But Elizabeth, what do you think?
Well, and I would just add that there's a sort of general guidelines for ethics in terms of reporting out on smaller samples. So for example, we did give each of the counties that participated their specific county data, but we didn't necessarily give them access to all of the data because of the small sample sizes in some instances. So we would not share certain information because of, like, for example, some of the open response questions, because then it's easily identifiable of what participant might have said what. So we can also help walk you through some of that in terms of the sharing of the data as well.
I have a quick question. I'm curious if can this data be considered sort of a benchmark? So if you're a county and you want to, do a, satisfaction survey, and you survey, 10 out of 20 of your participants, and you come up with do your reporting, and can you compare those results with the results here to determine if your program measures up, if it's doing better or not as well?
Shanti, I don't.
I think we're probably still building the benchmark. Like, I think it would be fine to compare. I don't think there would be any harm in that. But I'll say, like, when we were working with individual counties for this round of the survey, we did give a benchmark of, like, this is how you compare it to other counties in Ohio who are kind of similar to you in some ways. But I'd imagine, like, I think for right now, because this was a pilot study, we would want to compare like apples to oranges in this way and have somebody draw conclusions about how they're doing relative to a benchmark that might not be appropriate. So in some cases, probably yes, but in other cases, maybe not, depending on how similar those programs are to these 6 counties programs who we worked with.
So if other counties decide they want to use this instrument, would we want them to share the results with us so that we can start, developing a larger pool?
Absolutely. I was going to say that is that we would love, if you do end up using this tool, we would love to have access to your data and so we can add it to our database of this work, so we can start building that benchmark, so to speak. Just the more data, the better, in terms of having a more robust picture of what satisfaction in AOT is like. And no, we do not have diagnosis information. We did not ask for any health information about the participant. Do we have any other questions? Am I missing anything in the chat?
Doesn't look like it. Last call for questions.
Well, it looks like someone has their hand raised. Oh, I see your comments there. All right.
Well,
Amy, take it away.
oh, here I am. Thank you very much. This was so interesting, and I love that the audience, several members are interested in using this, because the more we, as they just said, the more data we have, the more we learn. So I put our email address, AOT@treatmentadvocacycenter.org. If you are interested in learning more about this, just let us know. And yes, there was a question about if we'd provide TA on this instrument, and the answer is absolutely. Again, thank you so much for your interest, and we will see you next month. Oh, wait, there's raised hands. Hold on. Let me scroll up. All right, Ash, you should be able to talk.
All right, let's give it a go. So I noticed on the survey, the gender questions are only male, female, and other, particularly in King County and Washington State. When we did our research of AOT, folks who qualify for AOT, we have a large representation of non-binary folks. So I was wondering if that can be expanded. Well, I mean, I know there's an other, but as somebody who is part of the LGBTQIA mafia, when I have to choose other, that I feel othered. So just putting that out there.
Yes, absolutely. We can change that to match the agreed upon practices within research on those different categories. We will absolutely make that change. Thank you for calling attention to it.
Awesome. Thanks.
Marissa, you should be able to talk now. Marissa Prince.
Hi, can you hear me?
Yes.
I am so sorry. I accidentally pushed the raise hand button. I am sorry.
No worries. No worries. We just don't want to
Thank you
ignore
for
you.
being patient. Thank you.
All right. With that, again, we really appreciate you joining us, and we look forward to seeing you in the future. Take care now.
Thank you.
Bye, everyone.
Thank you.